Hello, my name is Dr. David Hurst. I've been a practitioner here in Schreiber at J.E. Stokes for almost 30 years. We work with the North Shore Family Health Team as well as at the local hospital, McCausland Hospital, which is part of the Northern Superior Health Group. Today I've been asked to talk about the COVID-19 vaccine. And hopefully I can give you some points as to what's going to be happening with the rollout of the vaccine, and hopefully answer some of the questions that people have in terms of the safety and more importantly the vital importance of everybody getting vaccinated. I think that's going to be the important point that I'd like to get across. So as we know, the COVID-19 pandemic has been going on for almost a year. There was a very strong push from the beginning to start a vaccine program, and I would like to put a word of congratulations out to the Canadian government for being so forthright and being quick to order a lot of the vaccines, not knowing which ones would work initially, and making sure that we had enough to cover the entire population. So it turns out that we've got 2 approved vaccines. One is from Moderna, and the other one is the Pfizer BioNTech vaccine. Another one from Johnson & Johnson is in the approval process, and hopefully in the next week or 2 that'll be approved as well. Other vaccine makers are not that far behind, and they all look very promising. As this vaccine is being rolled out across the world, we're happy to say that there's a very high level of safety, very few allergic reactions, and those are easily treated, and we're prepared to treat those if people have the allergic reactions. It's not the typical ingredients that we see with other vaccines. These don't have egg or anything that we would typically see as an allergic reaction in previous vaccines. There has been some cases of people, passing away after the vaccine. Usually these people are very frail and older people, and it doesn't look as if there's a direct connection as of yet. Of course, every death is being investigated. That's part of the trials of these vaccines. There's ongoing surveillance to make sure they have continued safety as it's rolled out. But literally, tens of millions of doses have been given with very, very few reactions. So while the virus itself has up to a 2 or 3% death rate, we're talking about 1 person per million that have a significant reaction with the vaccine. I believe the government felt that because we only had 1 positive case of COVID in the area, that we were low priority. So they were prioritizing areas that initially were easier to get the vaccine out to, and probably had a higher level of illness that required a quicker response. We hope to, next week or the week after, begin the rollout of this vaccine. I suspect it's going to be the Moderna vaccine. We don't know yet. We think that we can give both those vaccines effectively because they have storage in Thunder Bay, and once they're thawed out, you're allowed up to 5 days to give them under lesser stringent refrigeration requirements. Initially, of course, we'll be focusing on the residents of chronic care and the long-term care residents of Wilkes Terrace. The other group that will be prioritized are going to be the staff at Wilkes Terrace and at the hospital, and medical staff that are in contact with patients. Other people that will be prioritized after that first stage, the second stage, will be people, seniors who have health problems, most likely subdivided into groups that are over 80 with health problems, and then slowly working through the population as we hopefully achieve vaccinations of everyone who wants one by the end of the summer or the early fall. It's also important to say at this time, we know the vaccine is very effective. The Moderna and the Pfizer appear to be over 85 to 90% effective. They are 2-dose regimens. So the initial dose does give you some protection, but probably in the order of 60%. The second dose, which we can consider a booster dose, will bring up the effectiveness of that vaccine up to the close to 90% effective mark. So highly effective. And the other thing is that the group that doesn't have pure protection, if they do get the disease, it's a far lesser disease. It's much less likely to be fatal, much less likely to require hospitalization. The medications we have for the COVID are really quite limited. The evidence is not there yet, not like the vaccine. The vaccine is going to be the one avenue that is going to get us through this pandemic. The medications are fine for people who are really ill, but there's limitations. Once you get quite sick and God forbid end up in ICU, these medications don't work as well, and they're not quite proven to the extent that we would like them to be seen. So the vaccines are going to be our way out of this pandemic. This is a public health problem. It requires public involvement. We often do things for ourselves, for our families. This is the one thing that we can do for our neighbors, for our community, and of course for our loved ones. As long as this COVID-19 virus stays in the community, there's going to be risks of its spread. And the experts often talk about 70% of people being vaccinated for herd immunity, meaning that if we can get to 70%, we may be able to start trending down the virus replication within the community, because enough people have the vaccination and the immunity to disallow the propagation of the virus. Our hopes, though, that more than 70% of the people will take the vaccines, because even if you have 30% of the population, you still have a large cohort of people that can get sick, allow the virus to replicate, and we know now that as this virus replicates, it mutates. Most of these mutations are probably quiet and what we call insignificant mutations, but we do know from the South African variant, the UK variant, and the new variant from Brazil that occasionally these mutations cause a more aggressive virus. They're more highly infective, and they potentially could be more fatal. The longer we allow this virus to circulate through the communities of our planet, the more chance of these mutations have it to take place. And this is the real concern. I know there's vaccine hesitancy. I know there's lots of information on the internet that can be misleading or difficult to understand. But all the scientific evidence suggests that this vaccine is safe, and it's required that we vaccinate as many people as we can, as quickly as we can, to prevent these viruses from mutating. There is a chance that if these viral mutations occur to an extent that may make these vaccines not as effective. And there's already evidence to suggest from the South African vaccine, or the viral entity, that this could be taking place. So it's another important feature that we deal with this in a broad manner and rather quickly. People will be able to read the evidence from the experts on the internet, CDC, the WHO, other reputable sources, to get the information to say, hey, this is why I need to be vaccinated. If we don't do this and we allow this virus, like I mentioned before, to continue to exist, it will mutate. Every time a virus replicates, there's a chance of a mutation of the RNA, and every time that RNA changes, the protein structure of the capsule of this virus could change such that, number one, it could be more aggressive, it could be more infective, and God forbid, the vaccines that we have already made may not be effective at stopping it. Now, the good news is, with the new technologies that Moderna and Pfizer are using, they're using a messenger RNA-based vaccine. This is the transcript or the blueprint for the actual vaccine. These can be modified very quickly. So as they follow the variants that are occurring, they can actually, through the booster dose or subsequent doses, change the structure of their vaccine to take care of the new strains. And so that's one good thing about the new technology that both Moderna and Pfizer are using. The national distribution, as far as I'm aware, is based on proportional population. So every province gets a proportion of the nationally ordered vaccine based on their population. Now, once it gets to the provincial distribution part of the equation, that will be determined by the provincial authorities. And I think that's where they've looked at, well, we've got a large outbreak here, let's focus more on this. The North Shore of Lake Superior doesn't have any. Maybe we can slow down. I don't think it's, they're not going to delay us for too long, but I think this is how they decided on that vaccine rollout. The easy part is the initial rollout. There's people within the hospital, people who are long-term care residents. That's easy. The next part, we've already identified all our patients who are over the age of 80 for the next phase. And as soon as that vaccine comes, we'll be notified then by phone. We've already contacted the vast majority of these people to see who is willing to have the vaccine. And a shout out to the residents of Schreiber and Terrace Bay. Most people have shown a willingness to get the vaccine. So we already know who needs the vaccine, and we already know who is willing to get the vaccine, at least for the next stage of the rollout. And once we've completed that, or getting close to completing that, we'll go down the list, we'll do the same thing. We'll approach people over 65 with health problems, or younger people who have particular health problems that make them at risk, and we'll ask them, and we'll get them listed, and they'll be followed up by a phone call once the vaccine is available. We don't know exactly where the vaccine will be given, whether it be given in the clinics or whether it be given in the hospital. I suspect, given the small area and the logistics, it most likely, given the small volume we'll get at each stage, will be through the hospital. But if we get larger amounts, we can certainly have vaccine clinics in each clinic, and we could vaccinate a lot more people quickly that way. So we know that once you've had the 2 shots, once you've had the 2 vaccines, you're going to be a very good chance of being immune. What we don't know is a couple things. We don't know how long it's going to last, the immunity. We don't know what percentage of people can carry the virus, not get the disease, but just carry the virus still, despite being vaccinated. And these are important issues that won't come to light until we do more studies with the vaccinated population. It would be perfect to just be able to have your vaccine and carry on your natural way. I don't think it's going to be quite that until we get the vast majority of people vaccinated. Just because, those two issues. One, can you carry this virus still to a small degree and pass it around, thinking you're impervious, yet passing this virus around? And the second is, how long will it last? And that's unknown. I suspect we're going to need boosters, maybe not quite as frequent as the flu, but I suspect we're going to have boosters. And just to touch back to the variants, it's interesting how this works. This is natural selection on steroids. So if you get a variant that has a better propensity for survival and infectivity, because that's how they survive, the only way a virus survives is it has to be replicated inside either an animal or, in this case, a human body. And if you don't have that, then of course it can't replicate. But what happens is the one that is a little bit more efficient at doing that becomes the predominant strain. And so that's why we need surveillance to look at what is the emerging strains, much like we do for the flu shots. In July of every year, we look across the globe to see what is trending in terms of the dominant flu virus, and that's how they decide how they're going to make the immunization or the vaccine for that year. This vaccination and personal protective equipment that we wear and social distancing, this is something that we do, and I have to reiterate this, not for ourselves, but for the community at large. And so this is just one time where I think people just need to look at your parents, you need to look at your elderly aunt and uncle and your neighbors that may have health problems, and the community at large, and say, yeah, you know what? It's really not that hard to wear a mask. It's really not that hard to not gather in large groups just for a little bit longer, because this is how we're going to save lives. There's still going to be a number of people that are going to suffer from severe infection from this point to the point that we get to herd immunity. However, on the bright side, as we immunize these high-risk groups, we're going to see a proportional decrease in the number of hospitalizations and deaths, because this is the group that's most vulnerable. And once we start getting the vaccines out, I think people will see that, hey, wait a minute, this is really dropping, and people aren't being hospitalized, people are not going to the ICU, and we're not seeing all these deaths. But another shout out for the people in North Shore. We've done a great job. Maybe it's because we all already live sort of a semi-isolated type of lifestyle, but we virtually, other than one infection that may have even been a false positive, because 3 days later that same individual got tested and the test came back negative, we have had no cases, no hospitalizations, and thank God nobody that we know of in ICU or has passed away because of this virus. So it tells you that what we've done works, and too bad that we couldn't get our message out to the rest of the country or to a larger population and say, hey, this can happen. You can do this. It works. Hopefully people will take away from this, continue the social distancing, the wearing the masks, the hand cleaning, the avoiding of crowds, especially indoors, and please get your vaccination.